Welcome to the Call to Flourish podcast, sponsored by Divine Mercy University. My name is Thomas Cronquist. I'm your co-host with Father Charles Sikorski, the president of Divine Mercy University. Father, how are you doing today?
I'm doing wonderfully, Tom. How are you?
Very good, very good. We are going to be speaking again with Ian Masson, who is the director of the IPS Center here at the university. And on another very interesting topic, today we're going to be talking about parenting skills for reducing children's anxiety. And I think that's having a number of children myself, 7 children. I'm very interested to hear what Ian has to say. So for those who didn't hear his first podcast that we did, can you give us, Ian, first of all, welcome to the Call to Flourish podcast. Can you give us a little bit of background, your educational background, and how you became involved with psychology and the IPS Center, Divine Mercy University and the IPS Center?
Absolutely. Yeah. Good to be back. So I'm, as you mentioned, I'm the director of the IPS Center for Psychological Services, and we are the on-site training facility that is affiliated with the university, where the doctoral students at the university come and start gaining experience, and how to actually work with clients, how to start putting into practice this model, this Catholic Christian meta model of the person that they've been learning about. And what impact does that have, practically speaking, in how you approach a client in a therapy session? So I myself am actually a graduate of Divine Mercy University. I was here from 2010 to 2013 and graduated with my master's in clinical psychology, and went on to become a licensed professional counselor in the state of Virginia. And I was, prior to my position as director of the IPS Center, I was practicing as a licensed professional counselor at a mental health agency in my hometown, doing a lot of general work kind of with clients, but specifically focused a lot on working with children and teens, who might be experiencing emotional difficulties, trauma, stressful transitions, things like that.
And there's one other benefit, probably the biggest benefit. I remember Ian when he was here as a student, but you also met your wife here while you were studying, didn't you?
Yes, I did. Yes, my wife and I actually were in the same class together, and we always joke. It was one of the funny things was in our child therapy class, which was taught by Dr. Nordling. It's child-centered play therapy is what we were learning how to do, and so we joked that our relationship kind of grew from the practice play therapy sessions that we were doing in class together.
Yeah, you're not the only one. It's one of the benefits here at DMU. We've had several. Almost every year there's a different couple that comes to not, because they've met here. I don't know if it's all about Dr. Nordling's class, but you also, now you have how many children right now yourself?
So I am father of 5 children on earth, 2 in heaven, and my kids range in ages from 9 to 1. So
Tom has 7 children, Ian's got 5, 2 in heaven. And so I feel totally unqualified to participate in this. So I'm going to let you guys discuss a little bit child anxiety.
It's interesting you mentioned that. I met my wife here when I was. So if anybody is, you meet some wonderful people at Divine Mercy University. So there's
you
do. You work here, you study here, but children's anxiety. When I saw this topic, my interest immediately peaked because we've talked in our first podcast with you. We talked a lot about anxiety and stress, but a lot of focus on adults and what adults are experiencing. Sure. Children, I know from experience, they live in different worlds, and rightly so. But can you describe some of the normal children's anxieties that they face, and how some of them might become problematic? I know that's a big question, but I'll just let you go where you want to go with that.
Sure. Well, you're right. Children do live kind of in different worlds. The stresses, the anxieties that they experience are not the same that we would experience as adults, but they're not immune to the impact of, well, really kind of what we've been going through. So if you think about the past couple of years, how There's been changes in structure and routine. There's been loss of life because of the pandemic. Maybe there's uncertainty with jobs, finances. Now we have in the midst of a war that's having worldwide repercussions. So children and teens have not been immune to the effects of these events. And, even before the pandemic, the CDC noted, that anxiety was on the rise in children and teens. So there are some that tend to be a little more, I guess, in terms of what specifically children might experience with regards to anxiety. Some of them are similar to adults. So there's something called generalized anxiety disorder, which is kind of this almost excessive, pervasive worry that occurs more often than not. And it's kind of a vague, not really sure what it is that's bothering me. But there's also one of the ones that's often seen in children, separation anxiety disorder. And that's a more marked and persistent fear that is kind of, more excessive, kind of unreasonable, about maybe the loss of or being separated from those to whom the child is attached. There's also specific phobias. Those might be more, related or anxiety or fear response that's tied to a specific object or situation. So, arachnophobia, the fear of spiders sort of situation. And then there's actually panic disorder as well, which is where you can have recurrent panic attacks, which is more defined as like this really abrupt, intense surge of fear that kind of like reaches a peak within minutes and might look like, pounding heart, sweating, chest pain, kind of maybe a feeling of choking, numbness, feeling dizzy, or even abdominal distress. And so these are some of the things actually that, both children and teens can experience in response to some of the stress and anxiety that they've been experiencing in the past couple of years.
One of the things I've noticed with my children and something that was exacerbated during the pandemic is their reliance on electronic forms of entertainment and communication. Certainly during the pandemic, schoolwork, my children are homeschooled, but schoolwork, communication with relatives, cousins, friends, they really highly dependent on computers, different electronic means. I call it jumping from screen to screen. I think in moderation, maybe, but in excess, it can be a source of anxiety because they're not developing the relationships that they should be, maybe as children. Can you speak to that a little bit?
That highlights, I think, two really important kind of dynamics. On the one hand, and you're right, social media and just the general kind of, we've been more plugged in as a culture over the past couple of years. So this is getting exacerbated. So on the one hand, it's very hard to read social cues when you're in an online interaction with someone. So there's a lot that gets lost when you're interacting over screens or by text messaging or messaging in social media. So that ambiguity and that, kind of uncertainty breeds anxiety in our kids. There's, especially as they get older and towards teenage, adolescence, they already have a sense of maybe worry about how other people are going to perceive them. And when they don't have that direct feedback that occurs in person, that can be exacerbated. Now, on the flip side, kind of an interesting dynamic that's been occurring as in some areas, things have been loosening up and kind of getting back more into face-to-face. There's actually more anxiety in face-to-face interactions because they've been relying on these forms of communication and interaction. So anecdotally, for example, I was talking to a campus minister who said, in talking with new college students who have been coming, they have difficulty maintaining eye contact. Like it's just their anxiety in social interactions is very difficult. and he'll talk to them about, oh, they were having this conflict with their friend, and he's talking to them about it. And it comes out, he asks, well, did you talk to them? And they said, oh, yeah. But then come to find out that by talk, they actually meant text. And so there's so much that gets lost. Again, we rely on our bodies to get that kind of direct feedback. But now having that direct feedback is a source of anxiety for children and teens as well, because they're not used to how to navigate some of those situations.
I've definitely seen that. Definitely seen that. They're more comfortable in front of a screen than at times than being face to face with others, you know. And
absolutely. Being in front of a screen, if you're, texting or messaging, it requires less risk. Like making friends face to face requires more risk because, there's that possibility that you might get rejected. But on the other hand, like that can actually be helpful. We learn then how to navigate, like not everybody's necessarily going to like us, and that's okay. The relationships that occur on social media or online tend to be much more shallow. And so first off, like there's more of a sense of like maybe imposter syndrome. You present yourself kind of a certain way. I wonder how many people like me or like kind of my page. What is my kind of like image that's presenting? All of these are kind of like sources of anxiety when you're interacting on a screen versus when you're interacting in person.
And I'm thinking that some of these, you talk about impersonator syndrome.
Mm-hmm.
What my children and other children are seeing is unreal, and their expectations about themselves might be in reference to what they see. So, I'm not like this person who might not really be what they say they are, and it's not a valid yardstick to measure oneself with,
It's not, but you're exactly right. It is what they go off of. You can have kids who agonize over what photos maybe that they're going to post to their social media account. And then they're maybe scrolling through feeds, and it just adds more pressure to, as you see others living, quote, awesome lives, even if they're not, it's again, just the image that's kind of being presented, the snapshot that's being presented. So that's one source that, again, of anxiety then, of like you're kind of comparing and kind of trying to keep up or, make yourself look like certain people. But then the other way that can contribute to anxiety is that kind of behavior and that dynamic can get very lonely. Because then does anyone really know me? Do they know the real me? Or do they just know the image that I present? And that in and of itself is a source of anxiety. Like, what is the real me versus the image I present? And I might not even really kind of know that.
What can parents do in that situation when you feel like, if you recognize that maybe your children are getting kind of sucked into this, internet culture where some of these problems start to happen, where they're, one easy thing is to say, well, just regulate, how much they look at the computer and so forth. But when this really starts to impact their self-image, and so what are good things for parents to do in that situation, to help them have better real relationships?
So in my work with parents, one of the things that I always emphasize to them is you are the best intervention for your child. And what I mean by that is oftentimes what is going to help them most is a relationship or connection with you, with their parent. And not every kid or teen is going to like this, but that might mean carving out intentional time as a family, maybe with that particular child, of like time with the parent, so that they can have an experience of we as parents kind of accepting and receiving them. Look, we just love you as you are. Like, you don't have to be a certain way with us. And then I think also, like you said, it's great. It's a tricky point, not always, or trying to navigate, limiting the screen time. but we have to put something good in place when we take something out. So what kind of other outlets or things am I encouraging or facilitating, in my child or teen? Whether, again, that's family activities, whether that's activities in the community or church, getting a job if you have a teen who's old enough, extracurriculars, things like those can be very important because they allow for the face-to-face interaction that often might be lacking, in the online world.
Ian, you're spot on. I have 7 children. I have age range 19 to 4. We have
Okay.
twin girls. The Lord surprised us with twin girls. But they all have different needs. And, it can be really challenging to spend time, quality time with all of them because, one wants to go play golf. One wants to build his go-kart. One wants to do something else. And my wife, when I'm thinking, well, I need to be doing this, I've got to finish this project. My wife has reminded me, Tom, they are the project. Just carving out quality time with each of them, listening to what they have to say because they want to describe something they've done or something they're interested in. That's the most important thing I can do.
Yeah.
It's time consuming, but you're spot on. And they really respond to that type of attention, interaction, and affirmation. So
they really do. It's, and that can maybe, especially for us, if you've got 7, 5 kids, I mean, even if you just got 3 kids, or 2 or 1, it can be, wow, I've got to, like, how much time am I supposed to be kind of giving to them? So I'll tell parents, some is better than none. And so if you can consistently kind of devote even like a 10 or 15-minute check-in a day, again, kind of like looking at studies that have been done or kind of anecdotally, Meg Meeker, I think she's a pediatrician, a doctor who works, with children and teens. And she was talking with one young girl who was telling about her experiences with her dad and how the dad, one of her highlights would be that the dad would come in right before bed and just sit on her bed and talk to her for like 10 or 15 minutes. And then when talking to the mom, she, Dr. Meeker mentioned this, and the mom's like, oh, he only did that like a handful of times. So I think that just goes to show like the impact that really being intentional about doing those check-ins can be. And it doesn't have to be a lot on our part. One of the things that we did was we learned child-centered play therapy, and we then approached our own kind of parenting and of like, okay, where each of our kids is going to have, quote, special playtime, which really is just being kind of intentional about being present with the child and entering into their world. And Tom, as you were saying, affirming them, kind of learning maybe what's important to them. And it's been a huge blessing, I think, in seeing our kids' development.
One thing I've noticed when I was growing up, way back in the day, we didn't have a lot of social media. We had there were 3 television channels, VHS, VHF channels, as they said, trying to remember, and a few fuzzy UHF channels. There weren't a whole lot of television options. So I remember spending so much time outside on my bicycle, playing games, sports. Just couldn't wait to get outside and to interact with my friends, people in the neighborhood. That's all changed, we've discussed. But one of the things, I think the negative side effects of spending a lot of time in social media is kids are exposed to the news in ways that I was never exposed to growing up. Serious things, they see it, war, all kinds of tragedies, school shootings, that they find it, they see it when they're in the internet. It's a world in there. And so they're being exposed to things that cause anxiety. And I notice my kids asking questions. I don't remember ever thinking along those lines when I was growing up. I don't remember ever hearing about a shooting when I was young. I don't remember hearing about a lot of different things that our kids are being exposed to almost on a daily basis. So how do parents navigate that? Dealing with answering very serious questions, adult questions, children, experiencing trauma, anxiety from what they're experiencing in social media.
Yeah, I think that is really something that can definitely exacerbate. And it's definitely a new challenge. I know even my dad would comment about when he was growing up, he'd go out and he'd be out all morning, come back for lunch, and then go out for the rest of the day. And for me, we had to have a conversation with my one daughter, it was like the day or two after the war in Ukraine had started, and she learned about it. And some of those things that you mentioned, like the, school shootings, it's like they all of a sudden know. So, and that's unfortunately, I mean, even if you have kids who aren't connected themselves, maybe your kids don't have devices, maybe they don't have social media accounts, but chances are the kids that they're around do. Mm-hmm. And so you can't really control what they learn from other people. So one of the best things that I found as a parent is to first, if we notice that our children are experiencing anxiety, really any strong emotion, is to listen to them and be with them. This might seem too simple, but children and teens are often used to being talked at. And so asking questions about what is bothering them, their thoughts, their feelings, and what is, worrying them can allow them to express fears and concerns. And then consequently, those fears and concerns seem less overwhelming because our children then experience our presence and they don't feel isolated in carrying some of those problems.
That's helpful. Also, I notice my children being aware of and asking questions about moral issues that I was not even aware of when I was growing up. You can go down to a list of the different hot button moral issues that adults are facing today, discussing today, et cetera. Children aware of those, not understanding them, asking questions about them. And I'm just wondering, do you meet them at the level of their question, or is it something like, you think, well, maybe they're not ready to understand, to unpack this, is there any kind of way to gauge your response to those kind of probing questions that adults are wrestling with at this time?
Absolutely. Right. And I think that's it's almost kind of like an ongoing assessment in a way that we're doing as parents, right? Of like not only how much can we share with our children, but how can we respond maybe to some of the things that they're learning in sort of like an age appropriate way too. So I think I'd like to maybe follow up with, so first, if we're going to sit and kind of ask them, what's worrying or bothering them. The second part, when they're coming to us with questions or concerns, I think would be to validate their emotions or maybe validate the concerns that they're experiencing. And so it can help to make empathic statements such as, okay, you're really scared, worried, et cetera, because fill in the blank. So statements like this, again, provide connection to the children who often feel alone, and they communicate to our kids that their experience is important to us. So I know, like with my own kids, when I start trying to fix a situation or kind of just provide too much information, they can end up getting wound up. And so that tends to be my first response is, all right, I want to validate whatever the emotion or concern is that they're bringing to me. And then after I've listened to and maybe sat with my kids for a while, then I can provide information, answers, or, possible solutions, calmly, accurately, in a way that's developmentally appropriate. So that might take some assessment on our part as parents. And so it is okay to also say, to be upfront and say, I don't have an answer to that. But letting them know that you can find that out together, if that would be appropriate. And I think there's some wonderful resources online about, having conversations with kids about different topics, whether that were the coronavirus or war, or other sources maybe of anxiety as well. But I would say that comes secondarily to the validating and showing empathy Because sometimes that's sufficient. Sometimes kids kind of have a question, and I've had my kids ask a question and I give an answer, and then they're, oh, okay, and they just go off. And they're more kind of curious about having somebody who they can kind of like go to.